I'm Dr. Jim Fick. I'm the optometrist and work with practices in both Clarksburg and Morgantown. I have a strong conviction that all medical decisions occur between patient and doctor. As a concerned parent, I should have the final responsibility and final authority to make medical decisions on behalf of my children. 48 states recognize this responsibility and authority. 3 million people in Mississippi and 2 million people in West Virginia do not have that right. We are only asking what 305 million Americans currently have: parental choice.
My name is Claudia. I'm a mother. I have a master's degree in special education. I'm also a co-founder of the grassroots movement, We the Parents, and I'm a very concerned citizen of Knoxville, West Virginia. I too believe that a parent and a child's doctor should be the ones to make medical decisions for that child. Today, you've heard from Dr. Swinker from the Bureau for Public Health. Later, you will hear from Dr. Kahn. Some are confused about what we are. We're not anti-vaccine. We are not here to tell anyone to not vaccinate. We simply want the legal right to do what we're already doing, which is to delay, selectively, fully vaccinate, or to abstain altogether. People in our group have varying perspectives. Some have religious views based on the fact that there are aborted fetal cells in many of the vaccinations. Some are concerned about 5-year-olds being mandated to be vaccinated against hepatitis B in order to attend kindergarten. That means your child can be fully vaccinated with all of the diseases Dr. Swinker mentioned, but if you decline hepatitis B, your child cannot attend public or private school in the state of West Virginia. We're not talking about measles and polio and smallpox. We're talking about chickenpox, hepatitis B, hepatitis A. The purpose of We the Parents is to help parents in the state gain the rights that those in 48 other states already have. We are not asking for a liberal exemption like California has. We are asking for an exemption that requires a parent to speak to their child's doctor to get an exemption. We will go into more detail, but the fact is exemption rates do not equal coverage rates. In the New England Journal of Medicine article, in your We the Parents packet, pages 22, 23, and 24, you will see a New England Journal of Medicine article which says not allowing religious exemption is not the way to increase vaccination rates. I have asterisks the part that says the way to increase vaccination rates is through education. And that's what we're here to say today.
Vaccines, like all medications, carry benefit and they carry risk. These hazards are acknowledged by the vaccine manufacturers in their product inserts. And actually, on page 2 of our booklet, there are 3 vaccinations that we've pulled for some of the vaccine adverse effects that are listed inside the insert. Vaccines have been credited with making remarkable progress in the prevention of infectious disease. We can debate all evening about the pros and cons of vaccination. It is all about parents having the right to weigh all the risks with all the benefits of any particular vaccination in their particular child. Patients have a fundamental right to refuse, delay any medical treatment. Even Dr. Oz has 4 children that are unvaccinated. We take our toddlers to the pediatrician, sign a form that acknowledges risks, but then are told that it's a misdemeanor if we do not comply. Not having the ability to refuse medical interventions is difficult for me to fathom in the 21st century in America.
If you look in your packets from page 3 to 11, you will see a slideshow from the West Virginia Immunization Network from their summit last year. This was pulled from the website online where it was posted. You will see where it says the first promulgation of interpretive rule was on February 28, 2008, that they added chickenpox, hepatitis B, and mumps. Turn the page and it says, why did the Bureau of Public Health file the interpretive rule? This agency wanted wanted to add these pre-vaccine requirements for many years. Next bullet, we were unable to move forward in the legislature either with a bill or a legislative rule. That's when they used interpretive rule to add those vaccines when they couldn't get it passed with the legislature. Move forward, it was used again last year in 2011 when they added adolescent immunizations or required immunizations. And there's no provisional enrollment. So if your children, your 7th grader and 12th grader attempt to go to school in August and they don't have these vaccinations, they're turned away. There is absolutely no provisional enrollment for these. In addition to adding those vaccinations, they also added recommendations, and they recommend a yearly flu vaccine, and they added the human papillomavirus vaccine, which is an STD. There is nothing to stop them from using the interpretive rule in the future to make these mandatory. We are asking for religious freedom, and we are asking that you look at the legislative goal of what it is you were elected to do. We elected you. We did not elect the Bureau for Public Health. We elected you as our representatives to represent us. It also included in your packet are the requirements to enter pre-K, to enter school, and to enter 7th and 12th grade. In the appendix is a list of who is in the leadership of the West Virginia Immunization Network. Included are the profits for last year for big pharmaceutical companies. Included also is a listing of the cost of those vaccinations per child, and you have to ask yourself, what is the motivation, and is there any fiscal gain to be had by anyone involved? Certainly not by any of the parents in West Virginia who don't vaccinate, who can't work because they're having to homeschool their children.
The polio vaccine is largely considered to be one of the most successful healthcare discoveries in the United States history. But we are not here to debate about the merits of polio vaccination. The number of mandatory vaccinations is exploding. Hepatitis B is a sexually transmitted disease. My toddlers are not at risk to develop a sexually transmitted disease. They are not sharing drug needles. They are not having promiscuous sex. All of us are at 1,000,000 times risk of developing STDs, as my 2-year-old daughter. Our pediatricians are quick to point out that since some kids can't handle food like dairy, eggs, honey, maybe you should delay eating honey or eggs for the first 12 months. Why is it so strange for us to consider that maybe 37 vaccines and the 37 doses of vaccines in our children is perhaps a bit too much for all of our children? It just doesn't seem unreasonable that all babies can't handle those numbers of vaccinations.
Also in your packet, after the recommendations, you will see a chart from the Center for Disease Control. This is no piece of propaganda. This is from the Center for Disease Control, the Morbidity and Mortality Weekly Report, which shows the 2009-2010 school year. I have underlined 2 states, Ohio and West Virginia. West Virginia's exemption rate is 1.3, with just medical exemptions. Go up to the top, Alabama, who has non-medical exemption, and their vaccination, or their exemption rate is 0.5. Exemption rates do not equal vaccine coverage. Those who are not vaccinated are not vaccinated. This will show you that there are over 20 states with lower exemption rates than we have, with just allowing a medical exemption. They don't go together. It may seem like they would, but there's not a correlation between the two. On the back of that chart, you'll see a list of the coverage by state for the DTaP, the diphtheria, tetanus, pertussis. You will see New Hampshire's rate, and it is rounded up, so it was like 99.7, so rounded to 100. Rhode Island, Connecticut, Alabama, Massachusetts, Delaware, Florida. West Virginia and Mississippi are not on here for having the highest rates of coverage. These are the states listed along with what their law is. We are not asking for a liberal exemption law. And the next page is the New England Journal of Medicine article.
40 48 states allow religious exemptions. This is not a new progressive idea, and it seems strange that we're even studying the fact that something that exists in 48 states shouldn't apply to West Virginia. Our high school wrestlers, football teams, fans, students, and cheerleaders are participating in sports in our schools. We play schools against Ohio, and Kentucky, and Pennsylvania, Virginia. All of these states have exemption laws that allow exemption. Why is there not a public health risk in those individual schools? Our state is geographically small, and 28 of our counties border states with exemptions. We are not surrounded by a wall. The idea that allowing religious exemptions to 1.8 million people in West Virginia is going to cause this huge public health risk is fear-mongering is the word that comes to mind.
Dr. King, let's call time.
Again, just in summary,
I just want to point out that the page before the appendix just say we would like to go to the law that you have passed, strike the interpretive rule that has been enacted, allow religious exemptions, and remove the language that makes it a misdemeanor to not vaccinate your child fully.
Thank you. Our next presenter